Hello, everyone. This is Nurse Imani. I'm coming to you from Imani Health Links. I wanted to share some information to you about diabetes and COVID. I am a nurse, registered nurse for DC, Maryland, Virginia, and I'm also a national case manager as well as a diabetic educator. What I found in our region is that diabetes has been affected by COVID in different ways. And I wanted to make sure that we can have some tips on how to stay healthy, what things can we do to definitely stay out of the hospital and as healthy as we can during this time of COVID. COVID hasn't left us right now in 2021, but we definitely have ways that we can actually be as healthy as we can during this time. So I have some slides from different websites, the CDC and American Diabetes Educator Association, as well as even the AARP, just to help us as a community be mindful of different tips that we can share that will help us stay in good control with diabetes during COVID. So let me share my screen, and then we can discuss some of the information that I found to be really helpful. According to the CDC, having type 2 increases our risk for severe illnesses from COVID-19. Now, having diabetes doesn't make us at risk of having it more than other people in the general population, but we do suffer from more severe illnesses, and symptoms are increased because of us having diabetes. So we definitely have to be more mindful to those of us who have diabetes. And even based on what we've learned, type 1 and gestational diabetes also can put us at an increased risk of having severe illnesses from COVID-19. Once someone is diagnosed with COVID, even if the symptoms are mild or we're recovering at home, it is found that it can elevate our blood sugars to be at a very high blood sugar level, or it can actually drop our blood sugars to be very low, below our target range. So it's very important that we understand that both those high levels or too low can be serious, and it does deserve medical attention. High blood sugar readings, it also let us know that it stops us from being able to fight COVID-19 because it stops the release of infection fighting white blood cells. And white blood cells is our army, is our fighting power to help us fight against any viral infections or bacterial infections. But high blood sugar stops the production of those white blood cells to really fight for us when COVID comes into our body. So we definitely want to make sure that our blood sugars are in very good control. Viral infections can increase inflammation, internal swelling in people with diabetes. This can also be caused by above target blood sugars. That inflammation can contribute to more severe complications. So we definitely want to make sure that we're monitoring our blood sugars as much as possible and as often as we can. On the side is our A1C. As diabetics, we do know that our A1C is a marker of a period of 3 months of how controlled our diabetes really is. So we really want to make sure that in this time of COVID that we are managing our diabetes and keeping it below 7 or close to 7 as possible. So close to that green mark. Anything in the red zone, 8.0 and higher, it does put us at risk for having to fight COVID a little harder because the sugars are just getting in the way of that white blood cell, which is that fighting power, that infection fighting white blood cells that really wants to fight COVID for us. So keeping our blood sugars and our A1C below 7 is going to be at ideal. 6.5 and below is definitely where we really want to be be able to stay away from those extreme complications of COVID. But sometimes we actually have low sugars, and that can be also very life-threatening as well. So low blood sugar levels, it put us at risk of life-threatening condition called diabetic ketoacidosis, or DKA. And DKA makes it very challenging for our body to manage fluid intake and the electrolyte levels in our body. So it really does put us at risk for preventing sepsis or infection. It actually makes us more likely to lose consciousness and other complications of diabetes. I mean, it also affects our heart and affects our kidneys. So having low blood sugars really can be very dangerous as well. But how do we know when we're even around COVID? So as you've probably heard over and over again for the past year that COVID-19 can be a range of symptoms as well. So we have to know the difference. We have to know that if we've been exposed to someone who was a positive COVID-19 person, or just out in the community and not wearing our mask, or we just at risk for some different, for different reasons, COVID is not going away. So we have to know how to identify some of the symptoms, and we can be exposed from 2 to 14 days before we actually have symptoms. So paying attention to the symptoms includes fever, and the fever, as we know, may only exist for maybe a day. It may be one night of a fever, but you may continue to have cough, shortness of breath, difficulty breathing, and getting progressive over time, increased fatigue, muscle aches, body pain, headaches, loss of taste or smell, even loss of appetite can be a definite symptom of COVID. Sore throat, congestion, runny nose, and also I wanted to let us know that even though we're in allergy season, some of us may think, oh, this is my allergies when I have this runny nose and sinus congestion. But if you're taking your regular allergy medicine and it's not getting better, then definitely let us know to, let your healthcare provider or get tested for COVID, because your allergy medicine should be, your allergy should respond to your medicine. But if it's prolonged or different than it usually is over the allergy season, then definitely get tested for COVID. Nausea and vomiting and diarrhea is definitely another symptom. It doesn't mean you have to have all the symptoms of COVID, but if you have one or two of these symptoms, pay close attention and get tested. But people have improved outcomes with diabetes and heart disease when they have controlled blood sugars. So those blood sugars within those target ranges, they have fewer complications when they are affected with COVID. So we may not be able to avoid COVID. COVID is not leaving. It's not going anywhere. So we know that we have to live with COVID, but we have to recognize the symptoms, and we have to know that we are taking care of our body overall, especially our blood sugars. So here are a few things that we can do to lessen the complications, and one of them is knowing your sugar. So monitor your blood sugars frequently. First thing in the morning is your fasting blood sugar. So I always tell my patients is check your blood sugar before you brush your teeth. No, the toothpaste have nothing to do with your blood sugars, but knowing what your blood sugar is and being consistent of checking your blood sugars before you start to eat anything during the day would be ideal. So fasting blood sugar should be from 80 to 120. That's before you have your meal, your breakfast. Then before lunch or dinner, you definitely want to see if your blood sugar is between 80 and 130. That's before lunch and dinner. And then 2 hours after any meal, you want to make sure that your blood sugars are under 180. Anything in the 200s, 300s, 400 range is too high. We know that that is not how our blood sugars should be. So if you are having blood sugars that are consistently above 250 for more than an hour or for several days, then you're at risk for DKA. You're at risk for different complications of diabetes. And we can go into symptoms of high blood sugars and low blood sugars more specifically at a later date, but just know what your sugars are. That's going to be your key. And then take action. Check to make sure that you're taking your diabetes medicine as directed, or your insulin as directed daily. So if you're taking it with your meals or before bedtime, definitely be consistent. This is not the time to slack off. We have to be consistent with taking our medicine and taking it as directed, especially with our meals. Test your blood sugars and keep track. of the results, and then contact your healthcare provider. You're in charge of your diabetes. So if you notice that your blood sugars are outside of that target range, above 180 or below 80 at any given time, definitely let your healthcare provider know. Also, please make sure that you have at least 30-day supply of your medication. So check your bottle, shake it, look at the insulin bottles. Make sure that you have enough medicine that's gonna last at least up to 30 days. Or if not, then make sure you're getting your refills. Things that you can do also is make sure that you have on hand some sports drinks, juice, glucose tablets, as well as extra refills on your prescriptions. Enough insulin to at least last up to 2 weeks or within the 30 days. And definitely because you want to make sure that if you're quarantined, if you're diagnosed with COVID, you know you have to stay quarantined for up to 10 days. If you're exposed to COVID, you have to be quarantined at least 14 days. So having enough medication within that time so you don't have to go out and having certain things on hand will be key. Also, I just have that follow your healthcare providers' tips on sick day regimens. A lot of times there's sick day regimens as far as crackers, soup, and certain things that the doctors may want you to have if you're diabetic and you're not feeling well. But also contact your provider. But how can we lessen our chance of complications? The best way is to stay active and to stay healthy. If you're comfortable, and I know this is a scary word, but we have to get vaccinated. I know that a lot of people have some apprehensions, but at this point is our best chance of staying healthy and getting through this COVID era of disease and avoiding the complications of the serious illness that COVID can cause. So COVID is the virus, but it can cause COVID disease, which is what we're trying to avoid. So the vaccine is actually providing us protection against the disease of COVID. So please get vaccinated. Any vaccine that's available to you, get it. That's the key. Not worrying about which one. They're all working and doing very well in the community and keeping us safe. Also, flu and pneumococcal vaccines are also recommended. You know, you've heard of this already about the flu vaccine. And if you haven't gotten it in the fall of last year, definitely for 2020, make sure that you're getting your flu and your pneumococcal vaccine. It's very important that we stay vigilant on staying healthy during this year. And it's this crazy time. So right now, why not get the things that we need to stay as healthy as we can. So stay vigilant on managing your blood sugars by staying active. Have an exercise plan. I know no one wants to get up and just do it, but sometimes that's what we have to do. But put it into a creative plan and be consistent on it by getting a creative pattern that you can stick with and being consistent. Consistency is the key. So set aside time to be active by walking, do an exercise video, even doing hand weights can be ideal in managing your diabetes. Thank you for giving me the time to share with you some quick and healthy tips on staying healthy in this time of COVID. And I hope that you continue to do well. If you have any questions, definitely feel free to drop me an email. Any topics you want to talk about, let me know. Hope that you're doing well and stay safe.